Dr. Andrew Bruns here today to talk about exercises and movements that you can do when you're having acute low back pain. And first thing I'll say is if you're having acute low back pain, that's a sign of a more serious problem. You certainly want to get evaluated by a professional and don't wait for it to get better on its own. Research shows that if you ignore those injuries and that pain, that's how arthritis shows up. You leave that fluid that's built up, that's putting pressure in your back and on the nerves, exposed to chemicals that can lead to arthritis and other more serious issues. So first thing, get evaluated. Second thing, if you know everything's okay, you're just slowly starting to ease into exercises. Maybe you're just looking for some alternative exercises or things that you can do on your own if you don't get a chance to get into the doc right away. These are some easy, gentle movements, some basic concepts in spinal health that I think would be beneficial for everyone to know. So first thing you can do is just evaluate which directions of movement of your spine feel okay or good for the back. The first movement you can do is reaching down towards your toes. For most people, since we sit all day, this is pretty tender to do. I'm just going to illustrate what someone might be like in acute low back pain, so I won't go any farther, but say you had pain there, you would stop. You might then try to lean back like you're doing a limbo. See if there's any pain increasing with this movement. Majority of patients respond well to this movement, which is called extension. That's the opposite of the work we do bending forward or sitting all day. Try a couple reps of that, see if that doesn't increase pain. If it doesn't, that's a healthy movement. You want to remember that one. Other movements include rotation. You can twist with your upper body to one side and then to the other side. Try these a couple times. The key is to go really slow. You don't want to do anything fast. If those movements feel good, remember those ones. The last movements for the spine are lateral flexion, sort of reaching down towards your knee. See if those feel okay. If you're alright with those, you can add those to your regimen as well. So looking back at what I just did, for a theoretical example here, it hurt to bend forward, it felt good to lean back, it felt good to rotate, and it felt good to do some lateral flexion. So what I'd add in is gentle movement like that every hour or so, maybe 10 times in each direction, really identifying the symptoms that improve with that movement. So for example, if I had leg pain or really severe pain, if I found leaning back actually made it feel better, then I might add that in a few times every hour. But the key is to keep things moving as long as it doesn't increase pain. You don't want to just stay in bed all day. That can lead to that fluid getting stuck in your joint spaces and causing more issues. Other key concepts, avoiding bending and twisting of the spine. We sit so often or we work with our hands reaching forward. That's constantly putting pressure on our vertebrae. It can injure the disc of the spine. So make sure when you're moving around, clench your six-pack just a little bit, keep that core tension there. It's not the same as sucking your gut in, it's actually tightening up as if you're flexing. So with that, if I had to reach forward, what I would do is focus on keeping my back straight, my six-pack tight. I would stick my butt back, and you can see my back is staying really straight. As my back is injured, I don't want to move my spine, I want to move with my hip joint that's not injured, and that's called a hip hinge. So that's a safer way to move forward. If you have to get something, even if you're reaching for the remote, make sure you don't twist to grab it, but rather you shuffle your feet so you're facing whatever you're reaching for. You can grab it that way, again, straight back, tight core, that is the hip hinge. And the other exercises I did with the movement, another name for those are McKenzie exercises. Those are both going to be key to protect your spine, especially when you're in a lot of pain. So you can always try those at first, but like I said, the most important thing you can do if your back's hurting is get a professional to take a look and get you feeling better.